Please, low urine output.
So it's low urine output. But what is that? You need to, if I say, what is anuria? You should know what is oliguria. When you say low urine output, it's relative. You need to be
Urine outputs of 400, less than 400 ml per day or 20 ml per hour.
That now you are specific. So don't just say low urine output. Some references talk about below 300. Yours is below 400. Yeah. So this is oliguria. And these oliguria will lead to accumulation of salt and water, or retention of salt and water. Please note this. So acute kidney injury is sudden reduction of urine output or renal function within, and that characteristics of AKI is it should be within 48 hours, and this will lead to accumulation of nitrogenous waste. Acute AKI will lead to accumulation of nitrogenous waste and other toxins. So if it's leading to that, it means a clinical presentation. A patient can also present with encephalopathy because there's a waste, nitrogenous waste there, and present with gastritis because there's also a waste there. So that is, and when you talk about AKI, what are some of the causes, general causes of AKI? We're talking about classification, but what are some of the causes of AKI? AKI, what are some of the causes? If we're talking about classification, what are some of the causes?
Okay, Dr. Attakorah, please. Excessive vomiting can be a cause, also diarrhea, and then patients with excessive burns can also present with AKI.
Good. So excessive diarrhea, vomiting, and burns. Why are you saying these could lead to what?
Okay, so for all of them, there's excessive fluid loss. So there's no proper perfusion, like the volume of blood is reduced. So there's no proper perfusion to the kidneys. So it can get damaged.
So in other words, all that you are trying to say is that all these conditions will lead to reduction or hypovolemia or dehydration.
Yes, please.
Good. And this dehydration will lead to what? Will lead to acute kidney injury. Good. Any other causes for that? Any other causes?
Certain infections.
Infections can also, infections at where? Infections at where? When you say infections, it's general or general infection.
No, so like
Who can tell me how septicemia? What are one of the vital characteristics of septicemia in connection with the vessels? Septicemia. Septicemia can cause acute kidney injury.
Septicemia can cause a drastic drop in blood pressure.
Why? Why? You are right. Why? And this drop in pressure can lead to a reduction in perfusion. So why will it be so?
So it causes widening of the blood vessel. That's vasodilation.
That's good. So it causes vasodilatation, and that will drop the BP, can cause hypoperfusion or hypotension. Hypotension can lead to hypoperfusion, and this could lead to that. So infection can do that. For example, septicemia. We have vomiting, we have burns, we have diarrhea. All these could lead to what? Could lead to any other. Class, any other causes of AKI?
It's kidney stones.
Kidney stone. Okay, kidney stone. Kidney stone. Somebody was causes of AKI, a lot of causes. So
Some autoimmune conditions.
Autoimmune condition can affect the kidney. Example is what? So you could have autoimmune condition that could cause destruction to some part of the kidney. That will lead to nephrotic syndrome. So it could lead to acute kidney injury because you are causing destruction to what? To the kidney. And we're talking about classification of acute kidney injury. Classification. Any other? Hurry up. Any other?
Is renal?
Please come again.
Renal artery.
Renal artery stenosis. We have a lot of causes.
So please, hypertension.
Hypertension can cause that. Hypertension. Medication. Somebody said NSAIDs. Medication can cause acute kidney injury. Urinary tract issues.
No, autoimmune.
Autoimmune disease. So these are some of the causes of some. We have a lot of causes of what? AKI. Please, I want you to understand the AKI. I say that for AKI, when there's a sudden drop of the renal function or kidney function within 48 hours, or when there's reduction of renal output within 48 hours, and this will lead to accumulation of fluid and salts and nitrogenous waste and other toxins. These drop in urinary output will lead to accumulation of these nitrogenous waste, other toxins, salt and fluids. And in some patients, we say causes of acute kidney injury. You should know the classification. Renal AKI. You have the renal AKI and you have the pre-renal AKI. So let me ask you this common question, simple and common. If you are asked about 4 or 5 risk factors for acute AKI, what will be? List 5 risk factors for acute AKI. What will be? What are some of the risk factors? Before we do, because these are common questions. Risk factors are asked a lot. Any condition, they like asking the risk factors. Oh, can you hear me?
Yes,
You can hear me. I can't hear you. So tell me some of the risk factors.
please, we have older age group.
Can you come again?
And we have and also exposure to nephrotoxic substances.
You can you come again because I didn't get your first.
Older patients.
Older patients. So you are talking about older patients. Okay.
Yes.
Older patients and what again?
Those who are exposed to nephrotoxic substances.
So those who are exposed to like what?
Like NSAIDs.
NSAIDs, good. What again?
Herbal someone with factors that cause dehydration, such as vomiting and diarrhea, or a burn patient.
Good. So these are some of the risk factors. So why do you say old age? Why do you talk about old age as a risk factor?
Please, okay, so for the old age, we can take maybe older men who are likely to have BPH.
Mm-hmm. Older women.
Older men.
Older women. Eh?
So,
So you are saying old age. That is what I want to know.
yes, please.
So old age. How would old age cause AKI?
So please, for the old age, we can take maybe the men who have BPH. So there will be an obstruction in the ureters. So please, it can cause AKI. Yes. Okay.
Okay. Again, old age. If there's nothing like prostate, that is what I'm saying. Older women. If there's nothing like prostate, how would old age be a risk?
Okay, so please, another example is these old people, they have some of these chronic diseases such as hypertension. So there is vasoconstriction. So there is impairment of So there is low perfusion to the kidneys. So please, it can also result in the AKI.
Come again. You said what?
Please, our older patients, especially maybe those with hypertension. So there is vasoconstriction. So there is low perfusion to the kidneys.
So older women will be prone to high BPs because of there won't be any flexibility in these vessels where there could be vasodilatation when there's the need that there should be vasodilatation. They can't have that because of destruction of these vessels. So the elasticity will be loss of elasticity, and that would expose or prone them to get high BPs, and these high BPs can affect the kidneys. So old age is one. You mentioned diarrhea, you mentioned vomiting, you mentioned these are all risk factors. Any other risk factors before
we have a question.
Okay.
For the old age, so can you explain it from the perspective that generally in older people they have deterioration of like their system. So even with the vessels and all that, they would not work as they should in a young person. So that can also lead to the AKI.
So I don't want to generalize it, be specific. The system, and when you talk about reduction in metabolic activities, affect everything, not only the kidney. You get me?
Yes, sir.
So what specifically within these conditions where there's reduction of activity would affect the kidney such that the patient would expose the patient to get this AKI? You get me?
Yes, I get you.
You are right by telling me that there's reduction in activity. And the activity is not only affecting the kidney, it's affecting the heart it's being affected. The brain, everything is affected because of the old age. So why is this reduction affecting or leading to AKI? So can you help me?
But I think it's related. So it's related to the explanation you gave earlier that it can affect the elasticity of the vessels. So they wouldn't so in the whole filtration process and everything wouldn't be that adequate.
So perfusion will be affected, and high BP will also, perfusion is one, and high BP will be two to cause destruction to the kidneys. So old age is a risk. Any other risk factors, please note them. It's important for you to know this. Note them. Any other risk factors for acute AKI?
Please, can you say profuse bleeding?
Bleeding can also cause that. Profuse bleeding can also cause that. Why? Why will profuse bleeding cause that.
So please, it will lead to
It will
hypovolemia
lead
and
to
then to reduce perfusion.
hypovolemia. To lead to hypovolemia. So it's also a risk. So please note, I said this to you. I said it, I'm repeating it. I'm saying that if you are asked about risk factors and you don't know, and you know the causes, mention the causes. Do you get me? Class, do you get me?
Yes.
Yes, sir.
If you know the causes and you don't know the risk factor, there's a thin line between the cause and the risk factor. If you are saying hypertension is a cause, hypertension could also be a risk. If there's no risk, it can't cause. So please, if you don't know. So back to the classification. Now we have the pre-renal, we have the renal AKI, and we have the post-renal AKI. So these are the classification. So let's take the
No, please, the classification again. You said pre-renal.
I'm saying the classification. We can classify acute kidney injury into three. So we have the pre-renal AKI. We have the renal AKI, and we have what? We have the post-renal AKI. So when you say pre-renal, conditions that would the condition is outside the kidney. It's like the post. The kidney conditions that will come before the kidney and that could cause this condition that comes after the kidney. Conditions, dehydration, hypovolemia, malaria, sickle cell. These are conditions that could lead to what? That could lead to acute. And that will cause pre-renal AKI. There are certain conditions that will come after the kidney. So organs like the bladder, the ureters, the urethra, if all these organs are affected, it could lead to acute AKI. And that if organs that comes after the kidneys are affected and is causing acute kidney injury, then we will classify that type as post-renal AKI. Please, is it clear?
Sir, please repeat it.
I am saying that if we have now, if you take the kidney, after the kidney, you have the bladder, you have the ureters, you have the urethra. I am saying that if these areas, ureters, bladder, urethra, if these areas are affected, if assuming you have obstruction within the ureters, and this obstruction is causing injury to the kidney, such that urine output there's a sudden urine output, then we are saying because it's coming from organs after the kidneys, we'll be terming it as what? We term it as what? As post-renal AKI, because it's affecting the organs after the kidney. And these organs are now, because these organs are affected, kidney is also affected. It's is post-kidney, outside the after the kidney. And if these organs are affected and is in turn affecting the kidney, causing sudden reduction of urine output, then we term this as post-renal.
Yes, sir.
If a condition affects the kidney itself, who can tell me one condition that can affect the kidney itself to cause urine reduction? If we have such a condition, then we would classify that condition affecting the kidney itself is leading to sudden reduction of urine output or renal function with renal AKI. Renal AKI. One condition that could lead, who can tell me one condition that could lead to?
Yeah, an autoimmune condition like lupus.
Lupus.
Glomerulonephritis.
So you could have, I've just even touched on when I was discussing PPL. I touched on one condition. So if that condition, if something is affecting the glomerulus, and we could have glomerulonephritis. If we have glomerulonephritis, and this nephritis, because it's affecting the kidney itself, renal itself, this is causing reduction in urine output. Then we say that we have renal AKI. Please, is it clear? Is it clear?
Yes.
So let's talk about these conditions that comes before the kidney, and these conditions could lead to. We have dehydration. Blood, there will be a blood supply to the kidneys. And if there's a reduction of blood supply to the kidneys, such that these kidneys, renal, the functionality of these kidneys will be affected. There's a sudden drop of this renal function. When you have such a situation, we term it as pre-renal. Pre-renal. Pre-renal.
Please repeat.
I am saying that we have the blood system, the blood, and there will be this blood, there will be a supply of this blood to the kidney. And this blood, when there's a reduction of this blood supply to the kidneys, and it's causing reduction of urine output or renal function, such that within 48 hours, there will be reduction. The blood will get into the glomerulus and there will be a filtration. So when you have reduction of the blood supply to the kidneys, it means that filtration, small amount will lead to small filtration. And this will lead to reduction of urine output. And because the blood supply, now we have the blood supply getting into the kidney. So it comes before what? It comes before the kidneys. There's a blood supply to the kidney. Because it comes before, fluid will get into the kidneys. So fluid getting into the kidneys. You get malaria. Malaria is within the blood. Parasites within the blood. And one is affecting the blood such that there will be reduction of blood getting into the kidneys. When this is causing the reduction of the urine function, such the patient can get oliguria, then we say that we have pre-renal. So condition outside, which comes before the kidney, before the kidney, that will lead to reduction of the renal function within 48 hours. That's
It affects the kidneys directly.
lupus will affect the kidney. And when lupus affects the kidney, it will lead to which condition? Because a lot of infection can affect, if it's affecting, it will lead to inflammation at the Bowman capsules, leading to, listen to me, leading to glomerular nephritis. Infection will lead to this. So at the end of the day, this is the condition I will be getting. You get me?
Yes.
So lupus will lead to what?
Well, it's the glomerular nephritis.
Good. So lupus will cause glomerular nephritis, and this will be termed as what? As renal AKI. You get me?
Yes, sir.
Good. So we want to tackle renal AKI, and take note of this. We want to tackle pre-renal today. We do pre-renal today. Tomorrow, then you continue pre-renal. So take note of this. The kidneys are predisposed to hemodynamic injury. The kidney is exposed to hemodynamic injury. So these hemodynamic injury will be as a result of hypovolemia or hypoperfusion. Take note of this. Hemodynamic injury. The kidney is exposed to hemodynamic injury. And this hemodynamic injury is due to one, either hypovolemia or hypoperfusion. So any condition that could cause hypovolemia or hypoperfusion could lead to hemodynamic injury of the kidneys, and that could cause the pre-renal. Take note of this. These conditions would expose the kidney to these to kidney injury, and there's hemodynamic. When I say hemo, you should understand dynamic. When there's these changes, and these changes could be as a result of hypovolemia or hypoperfusion. So now we are dealing with pre-renal. Now tell me which conditions could lead to hypovolemia, which condition could lead to hypoperfusion, and these will predispose the patient to hemodynamic injury. You should know that. Tell me one, then you continue. One condition that could predispose the patient to hypovolemia, and one condition that could predispose the patient to hypoperfusion.
Doc, septic shock,
So septic shock will cause what?
hypovolemia.
Septic shock will cause hypovolemia. And same septic shock. Septic shock I would prefer to say that septic shock will cause hypoperfusion.
Yeah,
Hypoperfusion than to say hypovolemia.
yeah.
What again? So when you talk about pre-renal occurs when there's impaired perfusion. impaired perfusion of the kidneys with blood. There's impaired perfusion. So when we have impaired perfusion of the kidneys with blood, so there's reduction of blood getting into the kidneys. And this will lead. So certain conditions like heart failure could lead to reduction of blood to the kidneys. And this will lead to hypoperfusion. And these hypoperfusion will lead to, because it's coming from the heart. The heart is causing that. It becomes pre-renal. So basically, pre-renal there's impaired perfusion. And that is basic cause of that impaired perfusion. And impaired perfusion could be as a result of what? Could be as a result of hypovolemia. Hypovolemia will lead to what? Impaired perfusion. So now when we are talking about the causes of pre-renal, you should know the causes of pre-renal. Initially, we were talking about general causes of pre-renal. But now, we are talking about general causes of acute kidney injury. But now we are narrowing it down to the specific. Pre-renal is as a result of low perfusion to the kidneys. That will lead to the pre-renal, low perfusion to the kidney. What are some of the causes? Now we are being specific. What are some of the causes of the pre-renal? So think about conditions that will cause low perfusion and conditions that will cause hypovolemia, and that could be the causes.
Doctor, I think severe diarrhea and vomiting will cause hypovolemia.
So severe diarrhea and vomiting will cause hypovolemia, and this will lead to what? Hypoperfusion. Good. What again? What again?
So please, burn can cause hypovolemia.
Burns can do that. Burns can do that. What again?
We also have hemorrhage, like those who are bleeding too much.
Bleeding, good. Bleeding can cause that. What again?
Excessive
Anemia.
Excessive what? Excessive what?
excessive sweat.
Excessive sweating can also reduce the plasma volume and cause that. So hypoperfusion, impaired perfusion, which is hypoperfusion to the kidneys. And so when you are thinking, you think around. What are the conditions that could lead to? You are mentioning some of the conditions. And you should also think about this. Hypotension can also lead to what? Hypoperfusion. So anything that could also lead to hypotension can also cause hypoperfusion, can lead to pre-renal. Please, do you get me?
Yes.
So when you are asked about the causes of pre-renal, then you should have in your mind the basic causes, the impaired perfusion to the kidney, hypoperfusion to the kidney. What could lead to this hypoperfusion or impaired perfusion to the kidney? One is the hypovolemia. Then you think about condition that could lead to what? Hypovolemia. You have been mentioned certain conditions that could lead to hypovolemia, talk about bleeding, we talk about sweating, excessive sweating, talk about vomiting, diarrhea, and co. Do you get me? This will lead to hypovolemia, which condition will lead to hypertension, such that, because hypertension also lead to impaired perfusion, which condition or what can lead to hypertension, such that these would extend to cause hypoperfusion. What are some of the conditions?
Heart failure.
So heart failure. What again?
Sepsis.
Sepsis. What again?
So you can have vasodilatory medication such as the ACIs.
So you could have ACIs. ACIs is good. You could have these medication, ACIs. What again? So if I ask you, how would ACIs cause acute kidney injury? You can tell me.
Yes, sir.
So tell me.
So ACIs will inhibit AT2, which will cause dilation of the efferent arteries. That will cause less resistance leaving the blood. That will reduce the ultrafiltration.
And therefore, when you say ACEIs shouldn't be used in acute, now you can appreciate that. Will you appreciate that?
Yes, sir.
So that's the simplest explanation that you can give. It's well done. Simplest explanation. So class, note this. I ask you, when I started, one of my questions, I was asking you conditions that you will not consider ACIs in right now. And you were talking about hyperkalemia, talking about stenosis, bilateral renal artery stenosis. And I added acute. So in acute, you shouldn't, because in acute, there's a sudden drop. And when you use ACEIs, it will further drop it. Pressure, pronounced vasodilatation to the efferent arteries. And that will reduce the intraglomerular pressure. And this will reduce the ultrafiltration or the GFR. And this will further drop the urine output. Please, is it clear to everybody?
Yes, please.
Class, is it clear to everybody?
Yes, sir.
So we're talking about pre-renal AKI. These are basically pre-renal AKI is when you have impaired perfusion to the kidneys, impaired perfusion to the kidneys. So you are looking at any condition that would reduce perfusion to the kidneys. And for perfusion to be reduced in the kidneys, please hold on for me. Hello. Hello.
Hello.
Hi.
Hey. So I've been talking. I was muted.
Yeah, oh, you are muted though.
Who did that? I don't think I
Please,
didn't do
I
that.
did.
You did.
Yes, please.
So I've been talking. So tell me. I had a call and you muted me. It wasn't anything. So well, I don't know where I got to.
Please, the last how ACI scores AKI, and we explained it.
So I've been talking now. God have mercy. So let me do the summary. Now you understand how ACIs can cause. You understand why it shouldn't be used in acute.
Yes, please.
The whole class, please. You understand? The whole class, do you understand?
Yes,
Yes,
we
sir.
understand.
Good. So in summary for pre-renal AKI, in summary, I said that pre-renal AKI basically is when you have impaired perfusion to the kidneys. And this will lead to, because there's these hemodynamic changes. These hemodynamic changes could be as a result of hypovolemia or hypoperfusion. And this hypoperfusion or hypotension, this will lead to impaired perfusion to the kidneys. So when you are talking about causes, you think about what are conditions that could cause hemodynamic changes. What are some of the conditions? So you look at hypovolemia. Condition that could lead to hypovolemia. Please, application at the ward. If a patient or when you are at the house and the patient is vomiting, having severe diarrhea, what should come into your mind is that this severe diarrhea can affect the kidneys. And when the patient develops acute AKI, or when the patient develops AKI, note the patient has moved from normal to a stage, a renal impairment, and you cannot come back to a normal kidney again. Take note of this. When a patient develops acute, it means that there's some amount of think about the kidneys. When you are not taking too much fluids or water, think about the kidney. You can develop AKI, pre-renal AKI, as a result of you not taking too much water. You can develop that. So conditions that could cause hypovolemia will lead to impaired perfusion to the kidneys. So we look at sweating, excessive sweating, look at vomiting, look at diarrhea, look at bleeding. All these could lead to a hypovolemia. Conditions that could also lead to hypoperfusion to the kidneys. Conditions like sepsis, conditions like septic shock, conditions like MI, condition like heart failure. Any condition that will reduce the cardiac output means that there will be a low perfusion to the kidneys. And conditions that will cause hypotension will also lead to it. Impaired perfusion to the kidneys, and this will lead to it. The pre-renal AKI. Please, any question? Please, any question? Can you hear me? Am I muted?
Please,
No,
no.
please. There's no question.
So if you don't have any,
No question.
if you don't have any question, tomorrow I will start with some questions. Then you continue with, or you don't like the question, few questions, then I will do, maybe I'll complete the intrarenal or renal AKI. Then we do the post. Then you do some of the clinical manifestation. So we'll continue tomorrow. So
Yes.
tomorrow I'll try to finish the post and the intrarenal. I'll try to finish. Then I'll see whether I'll move to the labs. So tomorrow, God willing, you meet. Good night.
Good night.
Bye.
Good night.